What I'd like to do today is just tell you a little bit about what clinical nurse specialists do and hopefully how we help you to live well with lupus. So when you get a diagnosis of lupus, it's just another ball to juggle really with your busy lives. You're trying to balance looking after yourself, a family, career, your friends, relationships. But lupus isn't something that just slots in nicely, is it? And sometimes it can just feel that those balls are just too much to juggle. Lupus doesn't sit by itself, it can impact and influence lots of other things in your life. So hopefully we can work together to help you with that. So when you get a diagnosis of lupus, there's a lot of different emotions, and I'm sure a lot of these things are things that you are familiar with, that you've thought about before. And we've done some work with young people, and they told us a lot about how they felt when they first had lupus, because it's a bit of an invisible disease, isn't it? People might notice that you've got a rash, but otherwise they might not notice very much at all. What the young people told us is that the time when people noticed there was anything wrong was actually when they got side effects from the treatment, when they actually put on weight and got a moon face from the steroids, and that's when people started to ask them what was the matter. But meantime, you're trying to cope with lupus, you're trying to sort out what it actually is, the fact it's not going to go away. You might have mouth ulcers, rashes, lose some hair, have stiff, painful joints, feel really, really tired, and you're trying to juggle all of that with all the other things you were doing before. You have an appointment with a consultant, you find out you have got lupus, you get some information about your medicines, you've got to come back and get blood tests, but then you have to go away and you just have to get on with it. And we're really aware that the majority of your life you're living with lupus and you spend very little time with us at the hospital. So hopefully nurses have evolved in rheumatology over many years and are recognised now by the National Institute of Health and Clinical Excellence as being a very important part of patients' care, to give them advice and support and help them through their journey. And what we want to do is help you to live your life fully with lupus rather than lupus living your life for you. So Ben and Caroline talked about a team approach. So at the centre of this team we have you as the person with lupus. At home you have your friends and family. And we talked about a multidisciplinary team. So that means that no man can island, no one person can look after your lupus entirely by themselves. Within the hospital we have different consultants. So predominantly you may be under a rheumatologist. If you've got kidney disease, you'll be under a kidney doctor. Lung disease, you might have to go and see a chest doctor. You have to go to imaging, you have to get your blood tests done as pharmacists. If you've got problems with your joints, you might see an occupational therapist, a physiotherapist. You might go and see a camouflage makeup practitioner. You might go off to see orthotics if you need a wig for a time. So lots and lots of different people involved in your care. And then out in the community, you've got your family doctor. They may not have very much experience of looking after people with lupus, so it's really important that us in the hospital support your family doctor and your practice nurse to enable them to look after you in the community as well. So what's a clinical nurse specialist? So we're all registered nurses. So years ago we were SRNs, then we became RGNs, that's what I am, and nowadays they just are registered nurses. So we qualify and then we have several years of experience in a specific area of interest. So I've been working now in rheumatology and renal overlapping for about 15 years. We do some additional training, so we get some expert knowledge and skills. I'm also a non-medical prescriber, which means that I can prescribe certain medications. And one of the benefits for that is that when you then come to clinic, you don't have to wait around to get prescriptions. So previously, if you came to see a nurse and you needed a prescription, you'd then have to go knock on the doctor's door and wait to get that signed off, and that delays your care and it delays the doctor from seeing the patients. Some family doctors won't prescribe you medications, but you can do that again, and that's freeing up the doctor's time so they can be seeing new patients or poorly patients. We should be educated to master's degree, and that means that we have an understanding of the research process, which, as you've gathered from today, is very important in improving the care for people with chronic diseases. And what I think is most important is that we are good communicators. So many of us will have done advanced communication skills courses or have counselling qualification. So then what do? So we can be a reliable contact for you. You get your diagnosis, you go away with your information leaflets and you have another appointment, you've got all those medicines and you can't really remember very much of what was said in the consultation. So hopefully you get a telephone number, and if you haven't already seen one of us at the point of diagnosis, you can ring us up and you can get some advice and reassurance and know you're not the only person. and hopefully direct you to support groups like Lupus UK as well. We give quite a lot of psychological support. Often people just need a helping hand, a bit of support, maybe a cup of tea and some tissues to mop up the tears when you come to clinic and it's all just feeling too much. We've got a really important role in helping you to learn to manage your own condition. You really are the experts of lupus. You know what it's like to have stiff, painful joints. You know what it's like to have the rash, to have your hair falling out. You know what it's like to just feel like you can't drag yourself out of bed. We know all the evidence about it, but you really know what it feels like. It's really, really important if we're going to make life better for people with lupus that we educate other people as well. So, for example, on Friday I had a newly qualified staff nurse sitting in my clinic with me. So she was brand newly qualified, going to be working on the kidney ward, hadn't ever heard of lupus before. So she sat and she listened in my clinic, and really importantly she actually got the opportunity to actually talk to some of the patients, to actually hear what it was like for them, how they came to have their diagnosis, what it's like for them having a kidney biopsy, taking all the medications and things. We're also involved coming out and talking at groups like this, sometimes going into universities and talking, sometimes talking to school children, lots and lots of different ways of interfacing with the public, and being involved in support lines. We're involved in audit and research. So audit, there's a big emphasis nowadays on audit in the health service. We need to be making sure that we're doing the things we should be doing and that we're doing them well. And if we're not, how are we going to improve that? So some of the things we've done within our kidney clinic is we've done our satisfaction with our actual clinic, and we've repeated that since the clinic has changed to include rheumatology and myself. And we've just done one about satisfaction after kidney biopsy, and we were particularly looking at that as to whether people had been offered sedation during the kidney biopsy to make them a little bit sleepy or not. And we're going to be making some changes to the actual process and procedures following on from that. It's really important that we're involved in research as well. So as nurses, we may be involved in actually helping people to be recruited to trials. Currently, there's a big focus on enrolling people who have rituximab into the BILAG study. We've learned an awful lot from the BILAG study. It means British Isles Lupus Assessment Group. So that's followed lots and lots of people with lupus in the British Isles over many years, and now those people who have rituximab, we're following them through. Rituximab is a new biologic drug. We've used it for quite a number of years in the UK, but it's actually an expensive drug, and because of the changes in the NHS, a consultant isn't allowed to just prescribe it. We have to show that you fulfil the criteria. By enrolling people into this trial, we'll be able to hopefully prove in time that people's long-term outcomes are improved, and then we won't have to jump through all these hoops to be able to prescribe the drug. But equally, I think as nurses, it's very important that we are involved in research with you as patients, actually finding out what the experience of living with lupus is like, so that hopefully then we can educate the doctors of tomorrow so that they have the right communication skills and actually address the things that are important to yourselves. As I said, we provide telephone helplines so that you can phone us up and get advice if you're having a side effect, if you're worried that you're having a flare, if you suddenly found out you're pregnant, or if you're getting a new job, or lots and lots of different things we do. And then we don't just work alone. We don't always know the answer, but we can usually find someone who does have the answer who can help you. So in our particular department, we're really lucky. We've got an excellent psychology service, and we've also got a social worker as well. So we can refer you to people like that for extra additional help and support. And then we do nurse-led clinics. So in my nurse-led clinic, I have 30-minute appointments, and I think that that gives me time to care for the whole person. So when you come to a kidney clinic, we're very concerned about numbers. We want to know how heavy you are, what your blood pressure is. We're looking at your kidney function, we're looking at creatinine, we're looking at your GFR, we're looking at what your protein level is. Lots and lots of numbers, inflammation markers. We want to know the doses of your drugs. But actually, there's so much more to it than that. So hopefully, when you come to clinic and you see us, especially if you're newly diagnosed, we can help you to unscramble the information. And if you think back to the slide with all the different words on it about lupus and fatigue and the drugs and things, you can come and we can just take time to go through everything. We can take time to explain things. We can give you leaflets and advice. We can signpost you to organisations that can give you extra help and support. We can also help you to understand your condition and help you to learn how to manage that. I have to say, I do say that tongue-in-cheek because you really are the experts, and I learn so much every day from working with you, and I absolutely respect and appreciate all that I learn from you all, so thank you. A big task that we have is about health promotion. So people's outcomes with lupus are so much better than they were years ago, but we also know that sometimes we cause problems with the drugs that we use for you, and actually lupus can lead to complications as well. So it's important that you know how you can keep yourself as well and healthy as you can. And we give support and advice, again, just looking at the whole person. You might be really, really worried about your kidneys, but actually you might have something going on at home which is far more important to you, and actually getting you some counselling might be the most important thing for you that we can do. And in some areas, nurses have taken on doing what we call an annual review clinic, and that's really like coming for an MOT to make sure that all the things we should be looking at, like checking whether you've got diabetes, making sure your blood pressure is well controlled, checking what your cholesterol is doing, but importantly making sure that you understand what all those things are for and why we do them as well. So part of keeping healthy with lupus. So not smoking is really, really important. I'm going to talk about a few of these things in a little more detail in a while. Being a healthy weight is really important. Keeping your alcohol intake within the government guidance, preventing infection, looking after your skin, coping strategies and relaxation, and trying to increase the amounts of physical activity that you do. Now, I've been told recently that physiotherapists don't like us talking about exercise. It's a bit ingrained in me, I'm afraid, but apparently, so long as you're doing some sort of physical activity that you enjoy, it doesn't really matter what it is. What we all should be doing, everybody, whether or not you've got lupus, is trying to aim for 30 minutes activity for at least 5 days a week. And you don't have to do 30 minutes all in one go. You can just build it up. It could just be going for a walk to the bottom of the road and back again, and trying to do that once a day and then twice a day, and gradually increasing your tolerance for doing that. And all of those things will really help to keep you healthy. So a really important problem for you that we acknowledge very much that we're not very good at helping you to manage is managing fatigue. There's lots of research being done in lots of different chronic disease areas now about trying to understand what causes fatigue and how we can actually improve that. What we do know is that sleeping well is really, really important. Sleep hygiene is the technical term for it. There's lots of advice out there. The sleep council, if you do go on the internet, or you can telephone and have some really good information about that. Activity is really important, so actually getting some exercise can actually help to reduce fatigue, and that can be a really difficult thing to try to get used to, but I've honestly had people who were really, really limited by their fatigue, who then, for example, a lady started swimming. She ended up going swimming 5 days a week, and it completely transformed her life. She just felt so much better, and her energy levels really improved. But as I said, it's got to be something you enjoy. It's no good going swimming if you hate the water. Relaxation has been proven to really help with fatigue as well. Some GP practices do actually have some self-help libraries where you can actually borrow relaxation CDs and the stuff that you can get from the internet. This is a CD. I would have played it for you, but this is a long one. It's 45 minutes long, and I thought it would just send you all to sleep. But if you learn to actually relax, what it means is you actually switch off from everything else and you sort of rest your body. And then when you sort of come out of that relaxation, you can actually feel re-energised and refocused, and that can really help with fatigue again. There's some excellent information from another organisation called Arthritis Research UK about fatigue and arthritis. And we know that sometimes just looking at pacing diaries, just looking at how much activity you can do before you get really fatigued and tired, can actually help you to plot things out for the future and help things like that. Unfortunately, they're not printable, but they can be downloaded, so that's why we don't have them in our clinics. Pain management is really important. If you're in pain, it often leads to increased fatigue, and then that means you don't really want to move around, and it's a bit of a vicious circle. Who's heard of mindfulness? So we know we've got good evidence that mindfulness programs and self-awareness and learning to relax can be really, really helpful for people with long-term conditions, and particularly with fatigue. So some organisations now within the NHS are actually setting up mindfulness programs, but there are some out in the community, and you can actually access it on the internet as well. And it's a 6-week course that you can do, and relaxation is very much part of that as well. And as I said, there's lots of research going on. A couple of Saturdays ago, I was actually in London at a symposium for patients who have another condition called vasculitis. And one of the professors working in that field is actually doing some research about what we call vagal nerve stimulation, and some people have had some really positive results from that. So just to say, there is hope for the future, we're not giving up on it. Lots of people were doing more and more to learn about the changes that actually happen in people's brains who do have chronic fatigue, and hopefully we will come up with some better answers in the future. And I just wanted to just present to you something that I learned from working with our psychologists. And I know when I often say to people, would you like to go and see a psychologist or a counsellor, they sort of think, oh, they're green and got horns. They haven't. They're brilliant people and they can be so, so helpful. But we all cope really differently. We're all really, really different. And how we think about a situation then changes our behaviour. So if you think, just bear with me because I'm going to read this one. So if you're in pain, you think, oh no, I don't want to move very much, this really hurts. If I move around, it's going to make it worse. So then the chances are that you might sit still, you get stiff, you don't go out to see your friends, and then things can actually get worse. And then you feel low. You might regret not going out, you might actually feel a bit resentful of your friends that you didn't go out to see, and things can really just go down into a negative spiral. And then actually your joints can become more stiff and tender, and then you actually feel more tired. But actually, if we actually think about how we react to the situation, and actually the next time we get some pain, think, okay, I'm a bit stiff, I've got some pain this morning, I'm going to take my painkillers when I have a nice warm shower, but actually I am still going to go out and see my friend. I know I might have to come back and have a rest later on, but that's what I'm going to do. And then that actually can change things, because you start to see a little bit of positivity. And when you go out and you've taken your painkillers, your mind's taken off the pain, you don't think about the pain so much, and then things start to feel better. And that's actually, it's really, really proven. We're all really different, but that can start to turn things around. So that would be one reason that I would say, if you are having problems with pain or fatigue, or you just find it really hard to cope with having lupus, which is absolutely understandable, if you are offered the chance to go and see a counsellor or a psychologist, I would heartily recommend it. So from the point of view, we'll move on now to thinking about keeping ourselves healthy. We know that lupus is a photosensitive disease. A lot of you may experience problems in the sun, coming out in rashes. It's really important we recommend you wear high factor sunblocks, that's at least factor 25 in bright weather. And I would hesitate to say in the summer months, because with the weather we have in Britain, it might be really sunny in December. High factor sunblock is actually available on prescription, so if you don't pay for your prescriptions or you get a prepayment certificate, that can be a good way of obtaining it. The one that we tend to use is Sunsense Ultra, and there is actually a tinted version, so if your skin is off colour, that can be really, really helpful. In the warmer weather, wearing hats, clothing that has UV protection, which you can buy from sort of outdoor activity shops. Sunshades, there's some nice umbrellas now that have got UV filters in them, and umbrella type things can be really, really useful. And please don't use sunbeds. If you do have problems with rash, or if your skin has lost, if you've got vitiligo, if you've got some scarring, within the hospitals, certainly at QE, and I think still at Dudley, there's brilliant camouflage cosmetic nurses. So there's nurses that have been specially trained to help you to learn to put makeup on, men and women, and it has a special fixative powder, and it's waterproof up to 12 hours. I've actually been to some of the appointments. It's absolutely amazing what they can achieve. So those appointments are available, they are accessible, and alternatively, what used to be the British Red Cross is now known as Changing Faces, and you can refer yourselves to those. If you have had problems with hair loss from your lupus, you are actually entitled to referral to what we call the wig service. The charge is the equivalent to paying for, it's about £68, but if you don't pay for prescriptions, you don't pay for it, and we do actually send you to really reputable places. So from Birmingham, you get to go to either Will's Wigs in Bronze Grove or Rackham's, and sorry for the advertisement, but it's just let you know you don't get hold of NHS ones. So not smoking, it's really, really important if you've got lupus to consider stopping smoking. We know that smoking affects your outcomes. We know people who have lupus and who smoke generally won't do so well. They may be more at risk of having infections. And really importantly, I guess that a lot of you are on hydroxychloroquine. We know it's a fantastic drug for lupus and it helps to reduce the risk of long-term complications. If you smoke, it reduces the efficacy of hydroxychloroquine. Nicotine replacement therapy, the stuff you get on the NHS, not the inhalers that you see lots of people using nowadays, it really does work. And what we do know is that if at first you don't succeed but you keep on trying, the more times you try to give up smoking, the more chances there are that you will be successful. Nicotine replacement therapy is available on prescription. You don't necessarily have to go to your GP. Some pharmacists nowadays are prescribers and they can actually do that on prescription for you as well. And some of them actually do smoking cessation courses. So again, having support, it's the same for trying to lose weight. If you've got support and you've got a point of contact, someone to reassure you, keep you motivated, that's when people tend to succeed and do so much better. Alcohol intake. Who knows what government guidelines are for alcohol intake? No. So I've put it up on here. So for ladies it's 2 to 3 units of alcohol a day, for men it's 3 to 4. And what's really, really important is that some of the lagers and things you can get, so we can have 3.2 units in just one can. And otherwise people might think, oh actually you're right, I can have 4 cans, that's not too much. But actually that's probably treble what a man should actually be drinking in one day. And what you shouldn't be doing is saving it all up, thinking, oh well, I'll be okay, I'll have it all on Saturday night. That's not the way forward at all. We know that drinking alcohol to excess isn't good for anybody, but it also can have a negative effect on things like your bones as well. So when we talk about healthy eating, lots of people want to know what's a healthy diet if you've got lupus. Now the only thing that I am honestly aware of that's ever been known to cause a flare is alfalfa, and I can't honestly say that I've ever seen it in the shop. So this is the healthy eating plate that's recommended by the government and Department of Health, and it's probably changed a little because actually we should have 1/3 of our plate should be fruit and vegetables, 1/3 of it should be carbohydrates. And lots of people think, oh, I'm trying to lose weight, I shouldn't have carbohydrates. Actually, it's what you put on the carbohydrates that is the thing that gives you the calories. And then the bottom 1/3 should be your meat, fish, or eggs, and then your milk and your dairy produce. And then the smallest triangle, unfortunately for me, is the biscuits and cakes and all the nice things. So what else do we need to consider with healthy eating? Well, in our kidney clinic, we're always talking to people about not putting salt on their food and not putting it in their cooking. So if you're looking on your labelling, a lot of it has a traffic light system now. So red means it's not so good for us. Yellow is okay, green's on a safe sort of limit. And if you're looking for sodium chloride, the maximum total amount you should have in your diet is 2.4 grams. So there's a lot of talk about a Mediterranean diet, which is rich in fruit and vegetables and olive oil. And generally speaking, the brighter the colours of the fruit and vegetable, the richer they are in antioxidants, and they're really good for us. We should all be increasing the amount of monounsaturated fats that we eat and increasing the amount of omega-3 and 6. And that's where the olive oil comes in. So the olive oil-based spreads and things, they're the things that are healthy and good for us. And I know there's been some stuff in the press recently about, oh, actually butter's maybe better for us. But I've checked it with a dietitian just last week, and actually they're saying olive oil type spreads are what we should all be eating. And oily fish is really good for us. So preventing infection, what can we do to prevent infection? So if you've got lupus, things like having your annual influenza vaccine is really good. Now lots of people tell me, I never had the flu, so I had my flu vaccine. What you get isn't the flu, it actually is quite a positive thing. If you feel unwell after your vaccine, it actually means your body's making a good response to it, so that then when the real flu bug does come along, you should be able to fight that off. We recommend, particularly if you're on steroids and immunosuppression, that you have what we call a pneumococcal, we call it a pneumonia jab, every 5 years. And you should avoid live vaccines while you're on immunosuppression. And for some people that are maybe over 70, if you get offered a shingles vaccine, the local consensus is that you're on steroids and, for example, methotrexate or mycophenolate, we advise that you don't have a shingles vaccine. So other ways of keeping healthy. So I spend a lot of my time talking to people, to you ladies, about whether they get their cervical smear screening done. It's not a terribly nice thing to talk about. It's not that nice to get it done, but it really can save your life. And we know that it's really, really important if you've got lupus that you do have this done regularly, particularly if you're on immunosuppression. It's really important to get your breast screening done every 3 years. There's now new digital mammograms, and so that means that they're able to extend the screening programme. So they start inviting you from when you're 47 up to a maximum of 73. And for men and women, the bowel cancer screening, you should be invited between the ages of 60 and 69 to do that every 2 years. You get a little card sent out to you at home, and you have to collect some poo on the card and send it back. And some person has a lovely job in the laboratory of analysing it. But again, it can save your life. It's really, really important. None of them are sexy. None of them are fun things to talk about. They're things that we don't really talk about. It's really, really important. It doesn't take much time, but it could save your life. So then with lupus, it's really important to try and look after your bones. We know that lupus can increase the risk of you having thinning of your bones, osteoporosis, if you're female, which most people with lupus are, and if you're on steroids. So things you can do to help without having a healthy diet, getting enough calcium, vitamin D in your diet, keeping fit, lots of activity, not smoking, a healthy alcohol intake, and then often, as Ben alluded to before, we often give you extra tablets. We start steroids, we give you something to protect your stomach, and we give you something to protect your bones. In clinic, what we should be doing is making sure we do fracture scores to look at your fracture risk, and sometimes doing bone density scans to actually assess whether you need those treatments, if you're on them, whether they've actually done the job that they should be doing. So hopefully, by doing all of those things, we're helping to make a difference for you, the people with lupus. Thank you.